decrease in your heart function. And it's likely that you had a recent heart attack.
Yeah.
Yeah.
Looking at the board, yeah.
We just didn't see the trend in troponins that we would expect with an acute heart attack. So you may have had it recently, and then now you have the fallout from all of the changes in your heart from that attack. Okay?
Okay.
All right. And then otherwise, your valves are still functioning pretty well. There's a little bit of regurg, which just means a little reflux of blood back into the other chamber that comes before it. But overall, it's just a major decrease in your heart function.
Which means what?
Yeah, so how do we deal with that?
So, since you had this acute heart attack, we need to look for any areas of blockages in your coronary arteries that might be amenable to stenting. So what we're planning to do is we're scheduling you for coronary angiography on Monday. Okay?
Which means tomorrow.
You're staying here.
You're staying here.
Unfortunately.
Which might be okay, because my mom is very sick.
Very sick.
So,
So we're planning for the cardiac cath to be done on Monday, and that's where they go either through the arm or through the groin, and thread a catheter up to the heart, and then we squirt dye into the vessels of the heart, and we look for any blockages there. And a few things could happen from what we see on that test. We could see either one lesion or two maybe that are blocked significantly, and then we can just put stents there. Okay? But if we see multi-vessel disease or disease in 3 or more of the main arteries, then at that time we might not consider stenting depending on where the lesions are, and then we would consider you a surgical candidate, or we would have cardiovascular surgery come evaluate you.
Okay.
You get all that?
I got that.
Okay.
What would your preference be in the future?
Send you home.
Yeah, it's not happening.
Beside that.
What's plan B, Dad?
Aside from that,
Yeah.
have you, we'll give you plenty of time to think about stenting versus surgery based on what we see in the cath, but it is something to start thinking about, whether or not you even want surgery in the future, if we see multi-vessel disease. Alright. But if it's just one lesion that we see that's caused that blockage, that caused that heart attack and the damage to your heart, and then we stent it, then that's fine. And then we'll put you on a blood thinner after that for a year that you'll have to take.
There's a problem.
Yeah, that needs to be passed by Dr. Chow.
Chua. Neurologist? Or?
No,
No.
he has
She's a surgeon.
diverticulitis, otis.
Lotus.
And he was here in May with a lot of bleeding. They couldn't stop the bleeding, and so.
Yeah, and that's why we've held aspirin so far.
Yeah.
But we'll talk to the GI physicians.
Yeah.
And
Yeah,
get their
she's a
word
GI
on it.
specialist, that's it, yeah.
But if you need a stent, your heart kind of takes precedence over everything else. So we would just have to be careful with future GI bleeds.
Yeah.
Yeah.
Yeah, that's going on for 20 years.
Yeah, it's been a long
Yeah,
time.
yeah,
But this was the serious one, is what they think led to the stroke and all that, so
Yeah.
that's why.
That's why I'm here.
Yep. Yep. So.
Yeah, but you never had any chest pain recently?
I
Yeah.
still don't know.
Yeah. Unfortunately, some people just don't have the classic symptoms of a heart attack. Some people might get nausea or vomiting only in a heart attack, or some people just might feel weak and dizzy, and some people just never have chest pain. It's hard to tell sometimes.
Okay.
So what time on Monday would the procedure be?
They never give us a time.
Oh, okay.
There's just an order, and it really depends on if there's an emergency case that comes in. Then you get pushed down the list a little bit. But right now you are scheduled for Monday. And then we're going to put you back on the low intensity heparin, just to try to keep your arteries clear of clots. Okay.
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 Whatever you think is best.
Any questions or concerns right now?
Oh yeah, concern I have a lot.
Yeah.
Question I don't have any. Yeah. How to treat my wife? How do you treat Denise?
What, she just got a cold, I guess.
Hopefully.
Yeah, but how do
Yeah.
you go with that?
Yeah, hopefully she just remains.
Tell her about all those things. Okay, you do that.
I'll tell her when I get home.
Yeah, she'll be fine. I'll leave this copy of the echo report
Okay.
with you. And
Now, did she make any comparison to last time?
yes, so here's actually your report from last time, and you're welcome to compare it.
Okay.
I underlined the most important changes that happened in this echo. Any other questions or concerns that anyone has?
My only question is, with him
She's
still
my
having
daughter.
pneumonia,
She's my other daughter.
with the pneumonia, what do we have to worry about? Or how does that play into everything that's happening on Monday?
So his white count, which is what we use to monitor infection, is actually improving.
Okay.
And it was normal today.
Okay.
His lungs are slowly sounding better.
Okay.
So we have him on antibiotics, and it should cover
Yeah,
him.
should be all right. All right.
How long might he have had that if it's pneumonia?
It's hard to tell if it's actually pneumonia or if it's
Okay.
just from his worsening heart failure,
Oh,
because
okay.
that can also cause fluid buildup in the lungs.
Mhm. Okay.
Okay. So with managing his heart failure and with treating for possible pneumonia,
Mhm.
we'll see improvement together.
Okay. Yeah.
And my weakness will tend to go away.
That's hard to say, because your weakness might have been from your heart attack combined with a possible what we call TIA or mini stroke or another stroke. We asked neurology to come by again, so hopefully they'll come see you again and see if they have any additional recommendations with these new findings. Any other questions or concerns?
Yeah, so I'm gonna work, I think we'll get stuff set up.
So let me know if you need anything, okay?
Thank you.
Thank you.
So diet-wise, is he on a strict diet or anything?
He's
Or?
on a cardiac diet, which has low sodium. And then light fluid. Usually recommend not over 2 liters of water a day.
That should make your mother happy.
Yeah.
No more than 2 liters a day. Your mother
She's
would
always
like
trying to push you to drink,
Oh,
right?
I see.
drink more water. Here's
Yeah.
water. Drink some
Drink your
more
water.
water.
Drink your water, Joey.
Okay. Well, if they tell her, fine.
Yeah. She not push that one.
Thank you very much.
Alright, well let me know if you need anything, okay?
Thank you.
Now where does he want to go to eat supper then?